Welcome to this session on male reproductive system. Specific learning objectives of this session are to outline the internal male accessory reproductive organs, to describe the male external genitalia, and to describe the parts and coverings of the testis and comprehend. The internal male accessory reproductive system organs include the vas deferens, the seminal vesicles, the ejaculatory duct, and the prostate gland, whereas the external ones include the scrotum and the penis. Now this is the testis, which is the primary reproductive organ in males. Now this is the epididymis, which continues as the vas deferens, and lying posterior to the urinary bladder is the seminal vesicle. The seminal vesicles and the vas deferens together join to form the ejaculatory duct, which opens into the prostatic part of the urethra. In the scrotum, it begins from the tail of the epididymis and tortuously passes upwards behind the medial part of the testis, and then it reaches the inguinal canal, where it is the principal constituent of the spermatic cord. It traverses the inguinal canal. So coming to the blood supply of the vas deferens is a branch of the superior or inferior vesical artery, which is a branch of the internal iliac artery. And vasectomy is the procedure in males, which is one of the ways for sterilizations and a permanent method, and a daycare surgery. The seminal vesicle is a pair of compressed pyramidal sac. So this yellow structure here is the seminal vesicle. So you can see that it's sandwiched between two structures. In front you have the urinary bladder and behind you have the rectum. So it's sandwiched between the base of the urinary bladder and the rectum. The seminal vesicle, it expels the contents during ejaculation. The base is directed upwards and laterally, and it comes in contact with the terminal part of the ureter. So this is the terminal part of the ureter, and this is the base of the seminal vesicle. The apex of the seminal vesicle is directed downwards, and it converges towards the base of the prostate gland. So this is the base of the prostate gland. So what happens is it joins with the vas deferens to form the ejaculatory duct. So it is supplied by the inferior and the middle rectal, inferior vesical and the middle rectal arteries. So at the ejaculatory duct here is formed by the union of the vas deferens and the duct of the seminal vesicle. The ejaculatory duct, it passes downwards posterolateral to the median lobe of the prostate. So this is the median lobe of the prostate, and ultimately into the prostatic part of the urethra. Now, where exactly in the prostatic part of the urethra does it open? Now, the posterior wall of the prostatic part of the urethra has a raised mucosal fold. This ridge here is called the urethral crest, and in the middle of the urethral crest lies an elevation which is called colliculus seminalis or the verumontanum. The ejaculate on the verumontanum opens the prostatic utricle in the middle, and on either sides of the opening of the prostatic utricle open the two ejaculatory ducts. So the two ejaculatory ducts, they open at the colliculus seminalis, one on each side of the prostatic utricle. So this is the entire male duct system, which is again projected here. The epididymis, the vas deferens here, then this is the duct of the vas deferens, this is the seminal vesicle joining to form, this is the ampulla, the ampulla of the vas deferens, this is the seminal vesicle joining to form the ejaculatory. The prostate gland. Now the prostate gland is again, it's an accessory male reproductive system. It's a fibromuscular gland which forms its secretions from the bulk of the seminal fluid, and embryologically it corresponds to the paraurethral glands of skin, and it's situated at the neck of the urinary bladder, and it's inverted cone shape with the base measuring about 4 centimeter. It measures about 3 centimeters in length and 2 centimeters in its anteroposterior thickness. The prostate gland is covered by a true capsule and a false capsule. The true capsule is the condensation of the stroma of the gland itself, whereas the false capsule is derived from the pelvic fascia. Between the true capsule and the false capsule lies the prostatic venous plexus. Now, this prostate gland has an apex which is directed downwards. It has a base on top and it has four surfaces: an anterior surface, a posterior surface, and two inferolateral. So this is the base on top, the apex below, and the two inferolateral surfaces. The posterior surface of the prostate gland has a transverse sulcus and a posteromedian sulcus. And on the transverse sulcus open the ejaculatory duct. Above the transverse sulcus here lies the median lobe, and on either sides of the posteromedian sulcus lies the lateral lobes of the gland. The inferolateral surface of the prostate gland is related to the levator ani muscle. Now, coming to the lobar anatomy of the prostate gland, anatomically the prostate gland is said to have 3 lobes, whereas surgically it has 5 lobes. The 3 lobes being 1 median and 2 lateral lobes, and surgically, apart from the 1 median and 2 lateral lobes, there is an anterior lobe and a posterior lobe as well. Now posteriorly, we just noticed that there was the posteromedian sulcus. Now this posteromedian sulcus is superficial and it does not extend to the entire extent of the gland. So just deep to this posteromedian sulcus, both the two lateral lobes, they communicate. So this communication between the two lateral lobes just deep to the posteromedian sulcus is what forms the posterior lobe. The two lateral lobes anteriorly are connected by isthmus. This isthmus actually contains glandular tissue only in infants. So in infants they make up the anterior lobe. Later it is replaced by just fibrous tissue. So this median lobe of the prostate gland, it's just anterior to it lies the prostatic part of the urethra, and posterolateral to the median lobes on either sides of the median lobe lies the ejaculatory ducts. Now the structures traversing the prostate gland include the prostatic urethra, the ejaculatory ducts, and the prostatic utricle. So this is the prostatic part of the urethra. The prostate gland is divided into 3 zones: a transitional zone, a central zone, and the peripheral zone. The central zone mostly includes the mucous and submucous glands, whereas the peripheral zone consists of the true prostatic or the main prostatic glands. It is interesting to note that in conditions such as benign prostatic hypertrophy, it is the central zone which is affected the most. Whereas in case of carcinoma prostate, it is the peripheral zone which is susceptible to get affected. Blood supply. The arterial supply to the prostate gland is derived from the inferior vesicle, the middle, rectal, and the internal pudendal artery. The venous drainage. The veins which lie between the true and the false capsule are the prostatic plexus of veins. Now these prostatic plexus of veins, they actually drain into the internal vertebral venous plexus through the Batson's plexus, or there's a communicating veins called the Batson's veins. So thereby any carcinoma of the prostate gland can spread to the vertebral column and the spinal cord. Lymphatic drainage. The internal iliac artery, the internal iliac group of lymph nodes, the external iliac group of lymph nodes, and the sacral group of lymph nodes. Nerve supply. The parasympathetic component is S1, S2, and S3, and sympathetic is from L1, L2, and the superior hypogastric plexus. So applied anatomy, as I just said, benign prostatic hypertrophy is a benign condition, usually in males above the age of 60 years, So I would like to stress here that prostate gland above the age of 60 years in certain individuals can enlarge, and that causes increased in maturation and difficulty in maturation, and thereby sometimes it could be treated medically or sometimes by through procedures such as transurethral resection of the prostate gland. The male external genitalia includes the scrotum, which encloses the testis, and the penis, which is the erectile organ and contains the distal portion of the urethra. The scrotum has a midline raphe, however the left hangs lower because the length of the left spermatic cord is longer, and it has a corrugated appearance and it is close to the testis. So this is the midline raphe here. The layers of the scrotum include the dartos muscle, the skin, the external spermatic fascia, the cremasteric muscle and the fascia, and the internal spermatic fascia. The penis has a root and a body. The root has three masses of erectile tissue, two crusts which are attached to the margins of the pubic arch, and a bulb which is to the perineal membrane. So these are the two crusts and this is the bulb. So this bulb is covered by a muscle which is called the bulbospongiosus, and the crusts are covered by a muscle called ischiocavernosus. And the right and the left corpora cavernosa have spaces which are called the cavernous spaces. The word caverns means spaces. So these spaces are for the blood to collect within and to expand during. So the coverings of the penis, we have the skin and underlying of the penis, and the prepuce or the foreskin is the part of the skin which covers the glans penis. The frenulum is a fold of skin which connects the undersurface of the penis to the prepuce, or the glans to the prepuce. Next, we have the preputial sac, which is the space between the foreskin and the glans penis. So this was about the skin, and then coming to the other coverings, we have the fascia, which is the superficial layer, which has a superficial layer and a deep layer. The superficial layer has a loose areolar tissue devoid of fat, and the deep layer we have the fascia of Scarpa, which is also called the fascia of penis or the buck's fascia, underlying which is the tunica albuginea envelope. So this is the prepuce or the foreskin, and this dilated end is the glans penis, and this at the base, this projecting margin is what is called the corona glandis, and on the undersurface is where you will find the frenulum of the penis. So this is a cross section of the body of the penis, wherein we have the skin, we have the superficial fascia, the deep fascia, which is also called the buck's fascia, the two erectile masses called the corpus cavernosum, in the middle of which we find the deep artery of penis, and this is the corpus spongiosum, which is traversed by the urethra. Yeah, and this is the frenulum here, and sometimes the frenulum can be too tight, and wherein in those cases we undergo a procedure called circumcision, wherein the foreskin is or the prepuce is removed. Supports of the body of the penis. The penis is supported by two ligaments, the fundiform ligament and the suspensory ligament. The fundiform ligament, it extends from the linea alba and it splits to enclose the penis. The suspensory ligament extends from the pubic symphysis and it blends with the fascia of the penis. Phimosis is a condition which is caused due to congenital narrowing of the opening of the foreskin so that the foreskin cannot be retracted. So again, in such conditions, circumcision is the method of treatment. Epispadiasis is a condition, and hypospadiasis, these are conditions of wherein abnormalities of the urethral orifice. Hypospadiasis is where the urethral orifice is placed on the ventral surface of the penis or the lower surface of the penis, and epispadiasis is where the urethral orifice is on the dorsal surface of the penis, anything above the normal. The testis is usually almond in shape. So this is the primary reproductive organ here, and it has two poles, an upper pole, a lower pole. There's an anterior border, a posterior border, a medial surface, and a lateral surface. The epididymis lies at the lateral part of the posterior border, and on the upper end of the testis is observed the appendix of the testis, which is a remnant of the paramesonephric. And then we have the tunica vasculosa. So each of the lobule is surrounded by a tunica. The parietal peritoneum. The factors which help in the descent of the testis, apart from the hormones secreted by the pars anterior of the pituitary gland. The spermatic cord contains a number of important structures. They include the genital branch of the genital femoral nerve, the testicular artery, the pampiniform plexus of veins, the ductus deferens, and the remnants of the processus vaginalis. The coverings of the spermatic cord include the internal spermatic fascia, which is derived from the fascia transversalis, the cremasteric fascia, which is derived from the cremasteric muscle, and which consists of cremasteric muscle and loose areolar tissue, is derived from the internal oblique muscle and the transverse abdominis muscle. The external spermatic fascia is derived from the external oblique aponeurosis. Hydrocele is a condition where there is collection of fluid in the processus vaginalis. Now there are different types of it. They are vaginal or infantile, where it is closed at the deep inguinal ring, or it could be congenital when there is a communication between the peritoneal cavity and the scrotum, or it could be encysted where it is in the middle part of it is patent and it becomes a cyst. Torsion of the testis is twisting of the spermatic cord. And variocele is just like the varicose veins which we see in the lower limb, the dilation of the veins of the testis, such as the pampiniform plexus of vein. And lastly, regarding the derivatives of the reproductive system, please do remember that the appendix of the epididymis, the ductus deferens, the ejaculatory duct, and the seminal vesicles are derived from the mesonephric duct, whereas the paraepididymis, the vasa efferentia, are derived from the mesonephric tubule.